Welcome. This video is meant to help you do a successful application for SoonerCare. About 1 in 4 Oklahomans of all ages is on a SoonerCare program. Over 1 million people each year in Oklahoma are on SoonerCare. Hi, my name's Steve Goldman, and I'm a health navigator with the Legal Aid Services of Oklahoma. This presentation will take you through the steps of a SoonerCare application. It looks like there's a whole lot of steps, but it really goes quite quickly. And the information that's needed for a SoonerCare application is all about your household and income. That's how people qualify for SoonerCare. Most people qualify by having income below particular limits, but those income numbers are based on how many people are in your household. So if we take a look here for a single person, income needs to be below $1,483 a month. But for a two-person household, and that could be two adults or adult and a child, income has to be under $2,004 a month. For the four-person household, and that could be two adults and two children, that could be one adult and three children, income needs to be below $3,049 for the adults to get coverage. That's what's new in 2021 with SoonerCare, is SoonerCare being available for adults with or without children. Now, the income numbers that we're looking at right now is for adult coverage. In households that also include children or pregnant women, there are higher income levels. What's also new in 2021 is that unemployed or zero income adults may also qualify. There's no work requirement, and there's no requirement to file taxes, either in the past or in the future. So if we look again at this income table, and you see how income limits increase with the number of people in the household, these dollar amounts are for the adults in a household. For children under 19 or pregnant women, they qualify at higher income levels. For example, the two-person household, an adult and a child, the child qualifies if income is above $3,050 a month. The adult in that same household qualifies if income is below $2,000. So that's one of the continuing differences, is different income limits for adults and children who are in the same household. So again, children and pregnant women stay on SoonerCare at the same higher income levels as always. The adults that are new to SoonerCare qualify based on a slightly lower income level. But again, the whole application is about household size and income. So as you'll see, most all of the questions on a SoonerCare application are about who's in your household, so they can count the number of people, and what is your income. And then the computer looks at a table like this to see, are the adults eligible? Are the children eligible for SoonerCare? The application seems so long because it asks the same question over and over again for every person in your household. So if you're a 1 or 2 person household, the application goes quickly. But if it's a 4 or 5 person household, it goes a little bit more slowly, but the questions are the same. So the application needs information about each person in your household, and it's always trying to match information electronically. So that's why you're typing in so much information, so that the computer can try and find pay stubs or your social security number, so that it can make an electronic match for you and you don't have to mail in an ID or mail in pay stubs. Go ahead and do an application. You can always redo it with different info and reapply at any time. There's help by phone at SoonerCare, and you see 1-800-987-7767. I want to go back to that idea that SoonerCare eligibility for most folks is based on income limits for your household size. So those are the two main topics of the application. There are some people who are over 65 or officially disabled or blind or have other disabilities who may qualify for SoonerCare under other rules. And those applications go through the Department of Human Services. What we're going to talk about here are the basic application for most folks who apply based on their income and household size. Is it worth the time to do all this? We think yes, because SoonerCare starts the same day that you apply. You're covered that day. And there's no monthly premium. There's no requirement to go to the doctor or use services, but it's very helpful to have your SoonerCare application in and accepted before you get sick, before you get hurt, because coverage for medical conditions does cover diseases that you might already have, like asthma or blood pressure. But SoonerCare does not cover bills from the past. So it's important to get coverage before you need it. And you can get SoonerCare now and only use it when you need to. At the end of the application, you'll have a SoonerCare card on the screen. You can print it or take a picture of it on your phone. What information is needed for the application? The information that they're asking for is all about right now, this month. And they're looking to do those electronic matches of info. So when you fill things in, use the legal name matching a social security card or another federal document. You know, folks who go by their initials like TJ Smith really need to write in their full name. And a social security number and a date of birth and a sex or gender that matches your social security card. They're trying to make that electronic match so you don't have to send things in. Then there's information about income. It will ask about your income, including tips, whether it's self-employment or not. It'll also ask about other income to the household. Are there disability payments, retirement payments, unemployment, rental or royalty payments? So how do you start a SoonerCare application? It's right there at the website, mysoonercare.org. Again, mysoonercare.org is the official state government Medicaid website. So two situations. If you have children on SoonerCare right now, then there's a SoonerCare application. And for the adults that are newly eligible here in 2021, just need to update the children's application and rerun it so that the computer knows to check to see, are the adults now eligible for SoonerCare? The other situation is new application for adults or children. Again, at mysoonercare.org and click on the button, apply for benefits, if this is your first time applying for SoonerCare. When you're doing a new application, there's a bunch of steps about creating an account. And so you click on create a new account, and then it's going to ask you to say, yes, I agree with the rights and responsibilities of SoonerCare, and then the sorts of things that you expect, that you need to fill in your name and your birth date and social security number and date of birth and filling out that sort of basic information. The application may also ask if someone's getting unemployment or in foster care, student, blind or disabled. Those people may be eligible for other benefits or other ways of qualifying for SoonerCare. So saying no to those questions is just fine. There's a question about someone needing long-term care, and that has to do with nursing homes. There's a question about whether somebody in the household, somebody in the family is in prison or jail. That's okay. That's part of figuring out how many folks are in your current household. For most females, there's an automatic question about pregnancy, answering yes or no or both okay. Pregnant women may be eligible for SoonerCare at those higher income levels for children and pregnant women. For each person, the application asks, do you live in Oklahoma? The answer has to be yes. For each person, it also asks, is this person a U.S. citizen, an alien with documentation, or none of the above? Now, you don't have to have the documents right now. You just have to be able to say, yes, I'll get one later if you need it. For example, a US citizen doesn't need their birth certificate right now, but may need to show it later. A non citizen, say with a green card or an employment authorization card, only needs the numbers off those cards. You may have to send a copy later, but right now, just need the numbers off those cards to mail those in. For non citizens, there's a whole list of 11 different documents that may make you eligible for SoonerCare. So that's why we say go ahead and fill out an application. Next, the application asks for your address, and it gives you an option to put in a different mailing address, say a P.O. box or a more stable, reliable address where mail is delivered. Because if letter from SoonerCare is returned because of a bad address, your SoonerCare gets turned off until you update your address. So there is an option for a different mailing address. You can have your SoonerCare letters sent to you in English or Spanish. It also asks for phone numbers and whether it's okay for SoonerCare to leave a message on your phone. And then enter an email address you can get to right now, because the next step is SoonerCare sends you an email with a code that you have to type back in. So we're still in that initial process of creating an account, and you make up a username for yourself, a user ID, put in a password. Please write those down because you'll need them again in a few minutes. And then you get an email from SoonerCare. And in that email is a registration code. So you go back to mysoonercare.org, type in your user ID and password that you just made up, and then type in that registration code you received. And then you're on your way to the whole rest of the application. So continuing with step one, people and contacts. This is the section where the SoonerCare application is looking to add up the household size. And they do that for each person because under certain Medicaid rules, children may have a different household size than the adults. So that's why you'll see the application asking how each adult is related or not to each other, how each child was related to each adult, and how each child's related to the other children in the household, so that the computer adds up a household size for each person. All answers are okay, and same-sex relationships are okay, and being not married is okay, being not married with children is okay. Continuing with people and contacts, if there's children in the household, there'll be a question asking if both parents of that child are listed in the household. If that other parent is not in the household, there'll be a question about cooperation with child support. And here you have options. If you answer no, it usually means that the children will get SoonerCare just fine, but the adults do not. To avoid this requirement, you can file what's called a good cause claim. And you'll see that on the screen, a button you can push for good cause claim for the adult to also receive SoonerCare. And that starts a process of a letter to you and sending in a letter from a friend or pastor or social worker saying that harm may come to the adults or children if you cooperate with child support. And you can call SoonerCare for more information. Then the SoonerCare application is going to add up the household size for each child, and so asks about the relationships between each child as well. So it seems like it's asking a lot of questions, but again, that's all to get to that point of what's the household size. And then it can look at what are the income limits for that particular household size. So we're to step two, which asks about a tax household. And tax returns do not have to be filed for SoonerCare, either in the past or the future. There's no requirement to file income taxes. This is really a what if section, because one way to add up household size is to ask if a tax return was filed, which adults and children would be on a tax return together. So that's what it's asking about. It's really a what if And so for each person, there's a place to put in tax filer status, and then are you single or married, those sorts of things. But again, tax returns are not required. And you finished up step 2. We're on to step 3, which asks about income. And a zero income is okay. Being unemployed is okay. There's no work requirement. And all income numbers that you put in are gross, meaning before any tax deductions or subtractions. And income amounts are for right now, this month. If you're self-employed, answer yes to the question income from a job, and then look for self-employment questions on the next page. You can enter your income as weekly, every other week, twice a month, monthly. For example, if you make $10 an hour and work 30 hours a week, that's $300 weekly. If you're paid simply $250 a week for deductions, that's $250. If you're paid every 2 weeks, that's the category of every other week. And then the application asks you to fill in your employer name and address and phone. That's again to make that electronic match. Can they find your pay stub in a computer somewhere so you don't have to send it in? Use the information from your pay stub, whatever the official name of your employer is, please put that in to make an easier match. That federal employer ID number is not needed. We're on to step 3 of the SoonerCare application, which is entering income amounts. Now, having zero income or being unemployed is okay. There's no work requirement. Income amounts that you type in are gross, meaning before any tax deductions or subtractions. Income amounts are also for right now, for this month. So, for example, if you make $10 an hour and 30 hours a week, that's $300 weekly. If you're paid a flat $250 a week, then you enter $250. If you're paid every 2 weeks, that's the category called every other week. If you're self-employed, answer yes to the question income from a job, and then look for self-employment questions on the next page. Self-employment income is net after business deductions. And then the application asks you to enter your employee name and information, and that's again to make a electronic match to verify your income so you don't have to send in a pay stub. You don't need the federal employer ID, and the application then will ask if they found the employer correctly in their list of employers. And you can check yes or just check the box that says, use the name I entered. Continuing with step 3, income. For example, if a person receives supplemental security income or SSI, enter that amount because it might make them eligible for other services. However, SSI does not count in total household income limits. Also enter any amounts before deductions for Social Security retirement or disability payments, unemployment, alimony if it was received that month, rental or royalty income, or the other categories that you see in the application. Do not include workers' comp, VA income, TANF, SNAP, food stamps, housing assistance, WIC, or child support payments. Those don't count towards income. It may ask you to put in child support amount. Go ahead, but it does not add into your total income for the household. And the application will ask you to repeat these steps for each person, including children. Now we're on to step 4, another place to put money matters in, but this part does not apply to most people. Most people will check no here. Only check yes if you have alimony that's paid out, student loan interest, educator expenses, and for some self-employed people, this is a place to enter self-employment tax and other self-employment matters. So step 4 goes really quick. Step 5 is about other health insurance. For most SoonerCare applications, you just check no because you don't have other health insurance. That's why you're asking for SoonerCare. And interestingly, the SoonerCare application doesn't have any questions about your health. You again are eligible primarily due to income and household size. So that's what the previous steps looked at, is income and household size. If someone does have current health insurance from a job or Medicare, check yes, because sometimes SoonerCare might be an add-on plan to supplement other health insurance. Now comes step 6, which is reviewing the information. Your computer screen will fill up with all the information that you typed in. Take a look, see if it's right, or use the blue change link on the right to make any changes to each section. And then at the bottom of the right of the screen, there's a box for no more changes. Step 7 sometimes shows up. That's if more information is needed about citizenship or identity. And it has a section for what documentation is accepted as proof. And it'll tell you what documents might need to be sent in. And now we're to the end. Step 8, submit the application. Read the information on the screen and look for the blue box at the bottom to submit your application. Sometimes it asks you to pick a primary care provider. That means the application was successful. But most of the time, the next screen you'll see says My Benefits at the top. And we'll take a look at that in just a moment. And for each person, it'll show whether you're approved, temporarily approved, or denied. Look on this screen to see if more information needs to be submitted. Sometimes a paycheck may need to be sent in, and those sorts of things can be uploaded to the website from, say, a photo on your cell phone. And this is where you can print your Sooner ID card or get it on the screen to take a picture of it on your cell phone. It'll also show you that your SoonerCare starts the same day as your application. So let's take a look at that screen. Here's the results screen. You can see at the top in the middle, it says My Benefits. And then you follow the red arrow there where it says Approved. Take a look at that line with Approved. It starts with that green check mark to say SoonerCare Adults. That coverage starts on this particular date. Then there's an end date, which is really your renewal date. And then the status being approved. So you'll get an answer right away when you finish your SoonerCare application. Down on the lower right is where you click to get your ID card, and it'll show up in a pop-up window on your screen to print or take a picture of it. We hope this has helped you with your SoonerCare application. For more help, here's the 800 number for SoonerCare. You can also do the application on the phone with SoonerCare. They're happy to type things in for you. And you call them at 1-800-987-7767. A copy of this guide is available online at okpolicy.org/countdown. Thank you so much.